Hello, thank you for joining me today as we update you on an exciting new resource for our providers and patients at Shannon. We announced in December that Shannon was selected to join the Mayo Clinic Care Network. This is quite an honor to be part of a prestigious network and have the ability to connect with one of the most respected healthcare systems in the world. With me today is Dr. Ryan Uitti, Medical Director at Mayo Clinic Care Network, to explain more about this clinical collaboration and how this special connection to Mayo Clinic resources and expertise can benefit our providers and patients here at Shannon. Dr. Uitti, thank you so much for being here today.
It's my pleasure.
Can you tell us what is the Mayo Clinic Care Network?
The Mayo Clinic Care Network is a group of healthcare organizations that have been highly vetted by the Mayo Clinic for two characteristics. Organizations that shared our culture, namely that the patient's interests were very important. And secondly, we wanted to share knowledge and experience in a way that would help patients and our care improve. So we selected groups from across the country who were independent and wanted to improve their care. The Care Network is now made up of more than 45 different members from Florida to Alaska and internationally, and we're really pleased to have Shannon as the newest Care Network member.
You know, when I look at the environment throughout the United States, there's thousands of independent healthcare organizations around the country. Can you help us understand why you chose Shannon to be a member of the Mayo Clinic Care Network?
Well, we wanted cultural alignment, so we looked at different potential members' mission and vision statements, but we wanted to see those mission and vision statements in action. And when we looked at Shannon, we found very strong leadership, and reviewing your data, we were very impressed, and we're hoping that you would be interested in joining the Mayo Clinic Care Network and joining Mayo Clinic on this journey to continuously improve care for patients.
Yeah, I think one of our big things is we're always looking to improve, and that's what we're excited about this collaboration, because I know there's always opportunities. We're looking at quality metrics or patient experience metrics, and what can we do better to serve our patients, to serve our team members too, and that way we can provide better care, continue to work on that, because I don't think we're ever there at the top. We're always working to improve what we're doing for our patients and families that we serve.
Well, and it's that spirit that we really welcome in the Mayo Clinic Care Network. We work together with the 45 organizations to grapple with some of the challenges that don't have simple solutions. And it just helps to have groups that you can trust, who you can share openly about information, and who share, that cultural alignment with, well, what's the bottom line? The most important thing are our patients and our goal to get better in terms of the quality that we're delivering, high value care.
The thing about Mayo Clinic is we have specialists, but y'all have a lot of subspecialists.
You're right, Shane. And what we can provide, I'm a neurologist, so I happen to be a movement disorder subspecialist. We've got 17 different subspecialty departments or divisions within our department. And so the average neurologist may occasionally have patients who they want to ask a question that maybe a subspecialist would be helpful for. So your specialists have subspecialists. It's in this way that we have been able to strengthen relationships with specialists across the country and really deliver, I think, care that allows more patients to receive their care from trusted physicians locally with no need to travel elsewhere.
Yeah, I just think it's going to be such a great resource for us to have the ability to contact, to get a second opinion, to get thoughts from like you said, the 17 subspecialists that you have in neurology. We didn't have that before, but through this collaboration, now we have that resource, we have that information to help provide better care here locally at home. You know, one of the things that we always continue to focus on, and I think many people in healthcare do, that focus on quality, affordability of care, the patient experience, and to access. How will this collaboration with the Mayo Clinic Care Network help us in the future when it comes to Shannon?
So Shane, we're also interested in exactly those topics. We do a lot of research and development or training of residents, fellows, and medical students. So our Care Network members are the first to know about things that we are experimenting with or have found to be useful. We really feel that this is the best way for collectively our whole network to improve with those very important questions that need to be continuously studied and hopefully improved.
And it's something I'm sure Mayo Clinic as well as Shannon, we're always looking at those areas and how do we improve upon them each and every day, because it kind of goes back to the patients that we're taking care of and the families that we're taking care of.
You're right. You're right.
Thank you, Dr. Uitti, for being here today. On behalf of Shannon, we are excited about this collaboration opportunity and what's to come. We are blessed at Shannon to work with an incredibly accomplished medical staff and clinical team. Collaborating with Mayo Clinic is one more step of bringing additional resources to Shannon to keep care local and to keep our patients here close to home with their family and loved ones. Thank you for joining us today. You can learn more on our Shannon website at shannonhealth.com/Mayo. That's shannonhealth.com/Mayo. Thank you. Appreciate you.